To John Torres with NBC News. This is Facebook Live, answering some of your questions about coronavirus, but also giving you some of the headlines that have been happening over the last few days, particularly over the weekend. If you have questions, please send them to us here through Facebook. We'll try to answer as many of those as we can. First, a couple of headlines, a couple of things that went on. Number one, we're finding out a little more about coronavirus, and we're finding out exactly how symptoms are starting to progress over the weeks that people have coronavirus. And here's what's happening. And some people are calling it the slow burn. So some people are describing the fact that they get symptoms with coronavirus and they kind of get low-grade symptoms. So they'll get fevers, they'll get runny nose and cough, dry cough, and just feeling a little under the weather. Then they start improving. Once they start improving, some people are saying after about 24 hours, all of a sudden they start getting a lot worse. And by a lot worse, I mean that's when they start having the breathing problems. They start getting chest tightness, chest pains, hard time breathing, and sometimes they end up in the hospital. So the tricky thing is, again, they get better, so they start getting symptoms, they start getting better, and all of a sudden they start getting worse again. And that they're finding out with coronavirus seems to be something that happens to a lot of people. And what doctors are saying is, so when you start getting that period where you're feeling a little better, make sure you keep a close eye on yourself or whoever might have it for the next day or two to see if those symptoms start up. And obviously, if you start getting shortness of breath in particular or chest pains, you need to go to the doctor. Call before you go just so they can be ready for you. But it might be something that's turning out to be a little more dangerous than most of us thought. The second thing is with coronavirus, we're finding out a pretty unique symptom that's happening that up until now we weren't really sure was associated with coronavirus. But what they're finding out is some patients are actually losing their sense of smell and their sense of taste. In South Korea, people that had coronavirus, they did a study and they found out around 30% of them said they actually ended up losing that sense of smell and that sense of taste. The two kind of go hand in hand. And here's what we think is happening. Our smell receptors are right at the top of our nose inside, right at the roof of our nose. Those smell receptors are the same place that the virus tends to settle in, and they think they're affecting those smell receptors, so then they're not able to smell. If you can't smell, you have a hard time tasting as well. But the good news is that people tend to recover from this over a few weeks, and they're getting that sense of smell back, they're getting that sense of taste back, which is a good thing. But they're also finding out that for some people, this is the only symptom they had, was losing that sense of smell, that sense of taste. Ear, nose, and throat doctors in England actually had an advisory from their committee saying, if you notice this in a patient, a couple things they should do. They should go into self-isolation because they're starting to possibly have symptoms and get tested at that point if they can to find out if they do have it. If they can't get tested, they're recommending 7 days of self-isolation, not the 14. The reason they're saying 7 days is because you probably already had symptoms starting before that, and if you don't get any more symptoms beyond that, you should be okay. However, here in the U.S., we're looking more at the 14-day incubation period, so I would recommend go the full 14 days just to make sure everybody else is okay, even if those symptoms resolve after 7 days. Now, again, the two big things we're noticing is one, that slow burn, where symptoms get better and then they start to get worse again. And when they get worse, they get a lot worse than they were initially. And people losing that sense of smell and that sense of taste, which seems to be a unique thing with this coronavirus. And nobody's exactly sure why that's happening, but it's certainly something to keep your eye on, especially if that's the only symptom you have. And the main thing is, if you have allergies and you tend to lose your sense of smell and taste anyway, especially this time of the year, it's probably the allergies. But if you don't have allergies and otherwise everything else seems to be okay and you start losing that sense of smell and taste, certainly something to keep your eye on just to make sure that it's not coronavirus, and talk to your doctor about what possibly could be going on. Now let me see if we have any viewers' questions here. So no questions have come across yet from there, but here's some questions I've been getting over the last couple of days and the last couple of weeks in particular. One of the big ones I've been getting is about pregnancy. If somebody is pregnant, what's the risk to the baby? What's the risk to the mom? What the American College of Obstetrics and Gynecologists have said is that if you're pregnant, it looks like, even though your immune system does get suppressed during pregnancy, it looks like that you're getting the same risk as anybody else who's not pregnant. And so your risk isn't going to be a whole lot higher. On top of that, it doesn't look like it actually gets passed to the fetus. Now, one concern is once the baby is born, as far as breastfeeding, what to do then, especially if you're positive for coronavirus. Well, if you're positive for coronavirus, they're going to have to separate you and the baby, unfortunately, because we want to make sure that baby doesn't get coronavirus, and that might entail pumping the breast milk and having somebody else feed the baby. If, on the other hand, you're not positive, but you still want to feed the baby and be careful with it, they're saying it's much more likely the baby's going to catch coronavirus from the mom being so close to the baby than from the breast milk. And so make sure as a mom that you cover up, you put a mask on, wash your hands before you touch the baby and feed the baby to make sure everything's okay at that point. And the main thing is to make sure both mom and baby are safe and healthy during these next few weeks as we're getting through this coronavirus pandemic across the world. So let me see if we have any questions.
What about mild asthma? Is that a big problem?
So the question is, what about mild asthma? Is that a big problem? So asthma puts you in the category of having chronic or underlying lung disease. And we know some of the big risk factors for coronavirus. Age is a big one, but also some underlying health diseases, high blood pressure, heart disease, lung disease, and diabetes. Lung disease, that's what asthma puts you in that category. So it does put you at a higher risk of having complications from coronavirus. Not sure it's going to actually cause you to get coronavirus any easier than anybody else, but it's certainly going to cause you, once you get coronavirus, to possibly have worse symptoms. So you need to be even more judicious about making sure you clean your hands and you practice that social distancing and that people around you aren't sick and that they cover up and just follow the recommendations we continually talk about to prevent yourself from getting this, because it could be a little bit worse if you have those chronic lung conditions. Any other?
Yes. Can coronavirus come through with cuts?
Can coronavirus go through hands with cuts? One of the things I say is a lot of people use gloves, and one of the things you have to remember about gloves is that our skin is really good at keeping coronavirus at bay. It doesn't go through our skin, it gets in through our respiratory tract, so our eyes, our nose, and our mouth. Issue is, if you have cuts, can it get in through the cuts? Theoretically, it possibly could, but it doesn't look like in this case it will, because the viral load probably has to be pretty big to get in through those cuts. And so I'd be more concerned about making sure your hands are clean. If you do have cuts on your hand, much like we do in the hospital in the emergency room, we do glove up at that point. We do make sure we're okay at that point, and avoid any kind of liquids that might be around, bodily fluids in particular. But again, more of a concern going through the respiratory tract than through skin or even cuts in the hand. Any other?
How about high blood pressure or emphysema? Are those things we should be careful about?
And another question is, how about high blood pressure or emphysema? High blood pressure is a risk factor for having worse symptoms and worse outcomes of coronavirus, and so is emphysema, which is the same thing as COPD, chronic obstructive pulmonary disease, which is another chronic lung disease, and so that puts you at a higher risk of having complications from this. And so anybody that has any of these things just needs to be extra careful. Another couple of risk factors we know about, a big one, smoking, and that's what happened in China, where you see a higher percentage of men dying from coronavirus than women. Part of the reason is that men, at least we think, is that there's a higher percentage of men that smoke. By some estimates, 50% of men in this area smoke, 2% of women do. And so more men were getting affected, and affected more severely. On top of that, another risk factor is obesity, and there is an obesity issue in this country, and so that could be an ongoing factor as we start moving forward with this pandemic and it starts becoming more and more of an issue.
Can clothing transmit that disease if you're at the grocery store?
So the question is, can it get in your clothing? Now, we know a couple of things, and a study in particular has shown in different fabrics and different materials how long it can last. On copper surfaces, and I'm not exactly sure where copper would be anymore, but on copper surfaces, which have a natural viral and bacterial killing factors, it looks like it lasts about 4 hours. On cardboard, about 24 hours. On plastic and stainless steel, it looks like it might last up to a couple of days. So the clothes are going to be somewhere in between that 4 and 24 hours, but clothes don't hold on to it very well, and it can get killed very easily in the washing machine. So the main thing is, and for people who might be exposed to this, if you're going home to your family, one of the big questions I get is, what should I do before I walk in the house? And this is something we did in the emergency room quite often, especially if there were a lot of sick people that day. Is you would come home, you would undress in the garage, put everything in the washing machine, start it up, and get in the shower, dress yourself up, and then go see your family at that point, so you're not taking it, just to make sure. But again, probably not going to last too many hours in clothing because it doesn't hold on to fabric all that well, but it could last a little bit, so you just need to be extra cautious. And let's see if there's one more question.
What about if you have hypertension but it's controlled? Are you still at risk?
So the question is, if you have controlled hypertension, are you still at risk like you would be if you have hypertension? No, if you have uncontrolled hypertension, that's going to put you at more risk because that affects overall body functions, overall body issues. So if it's controlled, although you still have hypertension, it's not going to put you at the same risk level. So the main thing is to make sure you do control your high blood pressure because, number one, for your overall health, especially long term, but two, also during this coronavirus pandemic, to make sure that it doesn't cause any issues going forward. Again, just highlighting and recapping a couple of the stories we talked about. One is the fact that this, what some doctors are calling a slow burn, where people start getting symptoms, they start getting better, and then all of a sudden their symptoms get a lot worse over about a 24-hour period. Some of them end up in the hospital at that point. And number two, the fact that some people are reporting a loss of smell and a loss of taste, upwards of 30% in one study. And for some people, that was the only symptom they had, that they actually had coronavirus. So if you do have that, self-isolate, call your doctor, see what you should do from there, because it's possible it could be part of coronavirus. But again, the main thing here is just to make sure you stay as healthy as you can, follow the things we know that work, wash your hands, stay home, practice social distancing, and just watch out for everyone else, just to make sure we're all okay and we all get through this as quickly and as healthy as we can. Thanks for watching.